Hi, my name's Taylor. I am a student at the University of Minnesota and also a nurse here at United, implementing a mobility promotion quality improvement project here. The general goal of this project is just to get patients up and moving during their hospital stay and meet those mobility goals. So, why does this all matter? Research shows that there is a strong correlation between mobility and better discharge disposition, decreased length of stay, decrease in injuries, better sleep, including better outcomes like less delirium and even fall risk reduction. So the goal is for 65% of patients on day shift and 55% of patients on night shift to meet their mobility goals. Of course, there's not always going to be exceptions, hence why the goal is not set to 100%, because some patients will simply not be able to reach the goal for various reasons. But we do want to strive to help over half of them achieve these goals on both shifts. Yes, working nights can be difficult as far as getting your patients up out of bed. However, night shift for our data is considered between 7 p.m. and 7 a.m. So at some point during that shift, we're hoping that patients can either get up and move around before going to bed or in the early morning hours, getting up and doing their standing weight or getting up to the for breakfast in the chair. All of those things are options for when you're working night shift. And of course, just chart those things, give yourself credit. You may have already noticed that there are posters up on your unit as well as scorecards. These are two ways that we're going to try to encourage increasing mobility in your patients simply by having an educational material out there and also by keeping you accountable by checking those scorecards on the unit showing how you're doing on each shift. We also want to incorporate a bedside shift report component discussing mobility each time that you are doing this so that you can also engage patients and families through discussion and more. Here's an example of what bedside shift report could look like. Of course, starting with an introduction of the oncoming nurse, updating the care board, and as always, discussing pain and comfort. At this point would be a good time to add in the discussion of mobility, what they were actually doing on the previous shift versus what their goal is, followed by the plan of care, and of course, the safety check. Let's focus in on the mobility aspect of the bedside shift report. We would want you to discuss things like barriers for the reason why the patient wasn't able to get up and move or meet their mobility goal on the previous shift, and also considerations for the next shift, like maybe asking for the night shift to pre-medicate the patient before they get up and move around during the day. It's also an opportunity that you guys can engage the family that's there at the bedside, maybe allowing them to incorporate a walk around the unit with the family member and the patient if you deem that appropriate. And then we also want to make sure that you're putting on your care board how they get up, assistive 1, assistive 2, Saraseti, etc. So you've learned about what this project is about. What can you do exactly? I'm going to go over that here in the next slide. One of the biggest things that you can do is simply have a discussion with your patients. This is a great opportunity to do it while you're even doing shift report, but patients are often unaware that, getting up and moving is actually going to help them and not hurt them. So engage patients in their mobility so they can take their own accountability and get up and move, take ownership of that. I also want you guys to check those scorecards, see how you're doing, see your weekly progress, and hopefully that'll just encourage you to continue to get better. And of course, asking questions by reaching out to mobility champions, the leaders on your unit, or myself. Thank you for the work that you've already been doing on your units to help patients meet these mobility goals. I understand it has been something that you've already been working on, and I appreciate the effort that you're giving here. Here's a refresher on that highest level mobility scale and also a QR code that leads to a survey just so I can get a better idea of where you guys are at with some of these initiatives on your unit. Thank you for watching this video. I've provided my email. If you have any questions, comments, or concerns, I am here to support you. Thank you again.